Okay, so we're going to start talking about our diseases and aging's effects on the nervous system. Move this out of the way. Okay, the first disease we're going to deal with is amyotrophic lateral sclerosis. And you probably have heard this referred to more as ALS. Buddy Valastro, actually from Cake Boss, his mom is suffering from ALS. And a lot of times it also is referred to as Lou Gehrig's disease. This is also the disease, or an offshoot of this disease, that Stephen Hawking is suffering from. So what exactly is ALS? Okay, what does it do? And when we're talking about what does it do, we're talking about its effects on the nervous system. What happens with ALS is the nerves, for some reason, waste away and they actually die. And because they don't regenerate, what starts to happen is we end up with paralysis or loss of motor control. And this typical ALS only affects the motor neurons, the skeletal motor neurons. So your thoughts and your processing centers are just fine, but your ability to move, to speak, to even eat is impaired. And the challenge with this is it gets worse with time. A lot of people with ALS, as they experience worsening symptoms, actually do commit suicide or assisted suicide because they don't want to live basically trapped in a non-functioning body. They lose the ability to speak, so they lose their form of communication. In the later stages especially, they lose their ability to eat. That is a voluntary function. So oftentimes they have to be put on liquid diets through feeding tubes, stents directly into their stomach. And this is not a quality of life that many people want to continue. So what causes ALS? Well, we know that about 10% of people with ALS have some sort of genetic defect or mutation that actually causes it. But the vast majority, the 90% that's left, actually we don't know what causes it. And that's part of the tricky part with ALS. We can't do a genetic test for 90% of the cases to determine if those people are actually going to be affected by ALS. It just shows up. Now the treatment, unfortunately for some of these treatments, the prognosis is not very good. The treatment, there is no cure. But there are certain drugs that people can take that can slow its progression. So it's not going to stop it, but it'll slow it down so that they can actually enjoy a prolonged quality of life and a prolonged life in general. Okay, so the prognosis. Prognosis means basically what is the outlook for a person with this disease. Usually once you've been diagnosed, you have about 3 to 5 years of life before you would actually die. Now for some people that is extended very long. I look at Stephen Hawking. He's over 70 and is still alive with ALS. That is a very unusual case. Eating and breathing actually become very, very difficult. People with ALS oftentimes end up on ventilators to assist them in their breathing. And the biggest problem and the biggest kind of issue that people have with ALS is they can no longer care for themselves. Many of these people are older. They don't want to move to a facility. They want to stay in their own home. And that becomes a big, big issue in terms of who's going to take care of them, how are they going to be taken care of, where are they going to be taken care of as this disease continues to progress. The next one we have is aphasia. And aphasia, in terms of its effects on the nervous system, what happens is we get damage to portions of the brain that are responsible for our language. So this is typically affecting, if you remember back to hemispheric lateralization, this is going to be in our left hemisphere. So what it's going to do in terms of how it presents itself in the symptoms is affecting our ability to speak or understand words. So we could have problems speaking, but we could also have some issues with actually understanding speech. Now, aphasia by itself is not usually seen. It just doesn't randomly appear. It's actually associated with a number of other problems that are related to the nervous system, and some of these we will talk about. So we can have a stroke, and we could have aphasia. In fact, speech impediments and problems speaking and communicating are often one of the early signs that you have a stroke that has occurred and you need to seek treatment. Another one would be head injury, something, a blow to the head, even, as severe as a concussion. A tumor, if you have a tumor growing in the brain and it actually pushes on that language center or affects its operation, then we will have aphasia. Some sort of infection, again, this could be virus, this could be bacterial, and there's a number of different ones that actually affect the brain. And dementia, which is basically a loss of logical thought patterns. So the treatment. Usually what you do with aphasia is you treat the underlying cause. In other words, since aphasia doesn't usually happen by itself, it's usually associated with something else. What you need to do is actually treat the underlying problem first. So, as a result, there's a wide range of possible treatments. Sometimes aphasia just goes and corrects itself. Some other people, though, may need things like speech-language therapy to reteach those muscles how to work. And you also could have computer-assisted therapy in terms of relearning words, how they sound when you can't form them yourself, and kind of imitate them. The outlook or the prognosis, a lot of this is kind of dependent on the underlying cause. So the amount of damage, where has been damaged in the brain, how motivated the patient is. If the patient is seeking out different therapies and is actually working quite diligently, they will have much more success. I thought this one was interesting, the handedness. So if you are left-handed versus right-handed, believe it or not, will actually affect your outcome. People who are right-handed, because that handedness center is on that left side of the brain, that left hemisphere, they actually tend to recover a little bit better than someone who is left-handed. I just thought that was really interesting. And the education level. People with higher education levels do tend to do their follow-up appointments with the therapists. They also do the things that they need to do at home in terms of in between therapy appointments. They understand that importance, whereas people with lower education levels actually don't. Most of the recovery, in order to make a full recovery from the symptoms of the aphasia, take about 2 years to complete. All right, the third one is ataxia. And ataxia, basically what happens with that is your muscle movements become very uncoordinated. In other words, with ataxia, you don't understand how your body is oriented in space. You lose that ability to understand that my feet are down and my head is up, or my hands are at my sides. You've lost that orientation. This affects different parts like your movement, your speech, your eye movement, and actually the most obvious one that is affected is your swallowing. You don't realize how much you swallow during the day, and that is actually a very coordinated movement with muscles and different tissues that are involved, and if that is disrupted, then it can create some major problems. In terms of the occurrence, how do we get ataxia? We usually have some sort of damage to our cerebellum, which is our coordination center. Remember, if you think back to these regions of the brain, the cerebellum is what permits that smoothing of the movement. So we don't move in, almost like robotic type of movements. Everything is nice and smooth when we move. It can also be a genetic issue that appears. If that gene for that is damaged gets switched on, it can actually cause us problems. More than likely, though, it's usually an effect, almost like a side effect of another disease. So with that being said, how do we treat it? With ataxia, there is no one specific treatment. Usually what we do is we treat the cause first. So like I said, there's usually an underlying cause, another disease, like a stroke or something that has happened. And so the first step is always to take care of that kind of bigger issue. And when that happens, then the ataxia tends to disappear. If, that, like with a stroke, it's not an immediate recovery. It actually happens over a long period of time. You can use adaptive devices to help with the functioning while that therapy is taking place, like canes, speaking aids, even modified eating utensils. They have utensils with longer handles, with bigger grips for people who have problems grasping. Sometimes they almost end up looking like toddler forks and spoons. They're very large because the fine motor movements of that coordination are not available to that person. So the prognosis, just like the treatment, is going to depend on the cause. If the cause is something that takes a while to recover from, it may take a while to recover from the ataxia. If the cause, the underlying disease, the effects last forever, then the ataxia, unfortunately, could last forever. There is a genetic type of this, and there is no cure for that genetic type. All right, the fourth one that we want to take a look at here is a cerebrovascular accident. Sometimes this is abbreviated as a CVA, but you probably know it better as a stroke. So what happens during a stroke? Basically what happens is blood flow to a certain part of the brain is interrupted. Now how this blood flow is interrupted can basically be two different ways. Basically, we can have a blockage of a blood vessel. For instance, let's say we have a clot that forms in a blood vessel someplace that breaks loose. One of the places that it can lodge is in the blood vessels of the brain, and that will actually then deprive the blood tissue beyond where that clot got stuck of the oxygen that it needs. And we know the brain tissue is very high oxygen demand. It will very quickly start dying. The other option is something along the lines of an aneurysm, where we get a weakened blood vessel wall that bursts. Again, that's going to decrease the amount of blood flow beyond the point of that bursting, and again, the blood tissue will start to die, or the brain tissue will start to die. In addition, the flow of blood, in other words, that pushing out of the blood into the brain tissue will damage cells as well. There's actually an impact force from that because it usually is coming out at a pretty good pressure. So the effect of a stroke is going to depend on the part of the brain that is damaged. So how do we know or how do we have a clue in terms of a stroke? There are some risk factors that are out there for strokes. That includes diabetes. People with diabetes tend to have more strokes than people who don't. Family history, so a genetic component, is also involved. History of heart disease. Okay, heart disease often includes things like blockages and clots, so those are things that doctors have to keep a very, very close eye on. High cholesterol. High cholesterol leads to those blockages within the blood vessels, and that can obviously create that stroke situation. Alcohol use is also very tied to the higher increased risk of stroke, as is cocaine use. Both of these substances actually have compounds in them that make the person more susceptible to blood vessel wall weakening within the brain itself. So, how do we treat a stroke? The more immediate the medical attention that is given is going to further reduce the chances of a permanent disability. Doctors often talk about what's called the golden hour after a stroke. Basically, as long as a person receives their initial treatment for the stroke symptoms within the first hour of the stroke, their chances of full recovery are greatly improved. Beyond that so-called golden hour, the chances for recovery actually decrease very, very significantly. But as with all of these things, it's going to be very dependent on the severity as well as the cause. If the underlying cause is something that's genetic, like family history, it may be harder to prevent it from happening than things that are lifestyle choices like alcohol or the high cholesterol, things that you have some control over. There are certain drugs that can be given to people who have suffered from strokes that allows them to have their symptoms actually controlled. So, what is their prognosis? Again, the prognosis, just like the treatment, is going to depend on the severity of the stroke. They may require long-term treatment, and recovery can actually continue for months or even years after their stroke. All right, the next one that we are going to do is dementia. And dementia is basically where we have impaired intellectual and emotional functioning that can include things like memory loss. Dementia is usually can get worse over time, so it's what we call a progressive disease. So it starts off not so bad, but as time passes, it actually gets worse. And this includes Alzheimer's disease. Okay, so Alzheimer's disease is a form of dementia. So how does the dementia occur? There are a number of different causes of dementia. Again, it's kind of like some of the other ones where we've talked about that there's no one single cause. You can have certain medications that can actually cause dementia or symptoms of dementia. Hormone abnormalities. If the hormone imbalance takes place within the brain, then that can actually lead to these symptoms. Brain tumors, decreased brain oxygen supply, as well as heart and lung problems, which will also impact that oxygen supply, can cause the dementia. So how do we treat it? Well, dementia is treated oftentimes by drugs that help improve the symptoms as well as slowing the progression. But unfortunately, you can't reverse the effects or prevent the disease. So once you have dementia, you can just slow it down, but you can't ever really reverse its effects 100%. In terms of the prognosis for patients who do suffer from dementia, after they've been diagnosed, they're going to require assistance for living and their basic life functions. And the level of care that they require is going to depend on the severity of the dementia. All right, the next one is probably one that you've at least heard of because it does tend to get talked about now a lot more in society, and that is dyslexia. Dyslexia basically impairs a person's ability to read and sound out words properly. What happens is the brain, and we haven't quite figured out that mechanism yet, switches the order of letters or groups of letters in words. And this can be really, really difficult, especially with someone who's just learning how to read, because a lot of the techniques that we use is sound it out. What does it look like? Well, if your brain is switching around those letters, it makes things very, very difficult. So how does it occur? Well, there is a genetic component. It is something that can be inherited. We also can have brain injury that can impact dyslexia and actually create it. And dyslexia that just kind of appears, especially later on in life, can be a sign of dementia. This is something that we tend to diagnose, especially the genetic type, in younger children. We see that when they're spelling, they flip letters around. We see when they're writing numbers, they invert them as well. It is something that will not ever go away, but what we can do is actually use different teaching methods as well as certain educational environments that actually helps them cope. So what we do is we teach them coping mechanisms and try not to allow them to get too frustrated and give up. The nice thing about this one, unlike some of the other diseases, is the prognosis for these patients is generally very good. Again, there are some variables here. The timing of the diagnosis. The earlier this is caught, the better. And sometimes that can be difficult when you're dealing with young children. If their family support is good, in other words, do you have family support to help them practice extra, or someone who's patient and can work with them when they're being frustrated? And are they self-motivated? Do they want to do better? A lot of times people with some of these things just kind of give up. And so if they're not self-motivated, it's one of those self-fulfilling prophecies where they think they're going to fail, so they go ahead and they fail. The next one is neurotoxin poisoning. Neurotoxin poisoning basically happens when we have sodium channels that get blocked from opening in the membrane. And if you think back to when we talked about how an impulse is created, that's the first step. We need those sodium channels to open so that we can get depolarization to happen. So when this happens with neurotoxin poisoning, our sodium channels don't open and we get no action potential. What this does is we actually get paralysis of the motor neurons. Now, neurotoxin poisoning happens in a very specific way. Typically, it's seafood that contains a neurotoxin. And so the fish that we have include puffer fish. They can have that neurotoxin inside of them. Bivalve shellfish like clams, mussels, and oysters. Now those shellfish are ones that we do typically eat a lot. The neurotoxin tends to be present when the water is at its warmest. And so if you ever go to like a raw oyster bar, a lot of times they'll actually have a warning on the menu about this, because when it's not cooked, that's when it creates a problem in these bivalves. So the general rule of thumb that I've always seen is you never eat raw shellfish during months without an R in it. So it would be May, June, July, and August. So September, October, November, December, January, February, March, and April, that's when the water is cooler and those neurotoxins don't tend to grow as well and be present in the amounts that causes problems in these bivalves. Now, this one is kind of strange. Fish that eat certain tropical reef fish. And so this is a wide range of fish like barracuda, certain types of snapper, moray eels, grouper, triggerfish, and amberjack. When they eat these tropical reef fish, it's kind of a bioaccumulation type of thing, where each of the tropical reef fish that they eat have a little bit of that neurotoxin. It doesn't hurt the fish, but they store it in their body and they don't eliminate it. So if we eat one of those fish, there is a chance that they could have a high enough concentration of this neurotoxin that would actually cause us a problem. Now, this treatment is kind of scary because there isn't really any. There's really no way to reverse the effects of a neurotoxin poisoning. Basically, what you need to do is have supportive care. So in other words, when you get poisoned, there's going to be different motor neuron paralysis depending on where that neurotoxin actually settles. You're going to need help to perform those functions. This neurotoxin also has kind of a flashback effect, so the symptoms can actually recur. So you may have had the neurotoxin poisoning 2 years ago, and you're going to have a flashback, and all of a sudden you're going to have that motor paralysis revisit. It's kind of an unpleasant thing. Okay, obviously as part of the prognosis, you can be paralyzed, on again, off again, which is kind of scary. You can have death occur because if you get paralysis of your respiratory muscles and you can't breathe, that's kind of a problem. but most people exhibit a slow recovery over time. So it does, again, take some time for this to reverse itself. Now, the last disease we want to talk about, again, is one that you've probably heard about. It's Parkinson's. This is the disease that Michael J. Fox has. So what actually does Parkinson's disease do? Well, within the brain, there are certain cells that produce the hormone dopamine. And when they are lost, we start exhibiting the symptoms of Parkinson's. We lose our motor control over our motor functions, and this exhibits itself through shaking and rigidity that gets worse with time. I actually had an aunt who had Parkinson's disease, and when my first memories of her, she's fairly normal, and then as I got older, the symptoms got worse and worse. It got to the point where she could no longer drink from a cup. She actually had to have a straw, because as she would hold the cup, it would shake so badly. Different things in terms of self-care obviously become an issue. Feeding yourself, getting dressed, driving. You lose a lot of independence with this. So we know the dopamine cells are lost, so what exactly is going on? Well, they're not actually just lost, they actually die. And the problem with Parkinson's is we really just don't know what is actually causing them to die. We haven't figured out that triggering mechanism yet in terms of why all of a sudden these specific cells are dying. We can't find a viral problem, we can't find a bacterial problem, and there's really no genetic link. So in terms of the treatment, there are drugs that can be described for symptom relief. And most of those reduce the shaking, like you saw in the video. The one gentleman took the L-Dopa, which is one of the medications, and just by replacing that dopamine, it actually alleviates a lot of the symptoms. But for some people, their Parkinson's progresses to the point where that's no longer working. Some people, and this is actually what Michael J. Fox did, he actually had very early onset Parkinson's, and it got very, very bad very, very quickly. And he actually did deep brain stimulation. Basically, he applied electrical stimulation to some of the very deep centers within the brain that were causing these tremors, and effectively kind of killed those cells. And what it did was kind of short-circuited them, and the symptoms went away. And so he was actually able to live a more normal life for, obviously he's still around today, but he was able to hide his symptoms very, very effectively. So with the prognosis for Parkinson's, there is, again, no cure. There is temporary relief, though. It does gradually get worse over time. Now, when I say over time, this varies a lot from individual to individual. It can be very quick and very severe, or it can stay kind of annoying, but not interfering for a long period of time and just get worse and worse and worse and worse. So again, it just depends on the individual. So the long-term effects depend on the specific circumstances of the individual. And this is really hampered by the fact that we don't know the cause. We could predict things a little bit better if we knew what was causing this disease. Now, the last thing we want to discuss is aging. And we're really only going to talk about exactly what the effects are, because there's really no treatment for aging yet. We haven't found that fountain of youth. And we know what the prognosis is. Eventually, we are all going to die. So how does getting older affect our nervous system? Well, as we get older, we see some changes. Specifically, we see some decreases in the brain size and the brain weight over time. The number of neurons also goes down. And a lot of this is due to neuron death because they're not replaced. Our blood flow to the brain decreases. And the synaptic connections within our brain also start to decrease. So this actually, we forget things. There's other things that can go on as a result of not having those connections. Some of these connections as we age are actually purposely kind of pruned. We spent our whole childhood learning things, and that makes new synaptic connections. But as we don't use those synaptic connections, our brain kind of starts pruning those back. And so if you think about when you retire, you don't use the same level of brain power and skill sets that you did when you were maybe working. And So the brain starts to kind of cut those back, and that tends to be associated with being older. The one thing that does increase is intracellular deposits. And those intracellular deposits we think may be one of the links between or to Alzheimer's disease. That's one of the things. They're called plaques. And we're thinking that they may have something to do with Alzheimer's.